You swallow a pill to cure a headache or manage your blood pressure, but inside your body, that same medicine can start secretly dismantling your digestive system from the inside out. The human stomach functions as a heavily fortified castle, specifically built to contain caustic hydrochloric acid, a fluid corrosive enough to dissolve metal, while protecting your surrounding internal organs from being burned. The master pharmacological matrix details how common medications breach natural defenses. There are 3 mechanisms of attack: breaking the stomach's entrance valve, halting its internal clock, or starting direct chemical fires on the tissue walls. Recognizing these 3 specific traps provides the mechanical insight needed to help protect the gastrointestinal tract from long-term damage. The stomach's first line of defense is the lower esophageal sphincter, or LES. The LES is a ring of muscle at the entrance of the stomach that acts like a tight vault door to lock acids safely below. Looking at the first column of this chart, we see the valve/decreased LES mechanism, which details the drugs that chemically force this muscular door to relax and crack open inappropriately. Nitrates and calcium channel blockers are major triggers for this exact relaxation. With the gate physically hanging open, corrosive stomach acid escapes upward into the unprotected esophagus, heavily burning the delicate lining. By hacking this specific biological mechanism, a routine medication prescribed for heart health can trigger chronic acid reflux. The stomach also relies on an internal motility clock. This biological timer guarantees that food and acid are churned and eventually pushed out into the intestines on a strict, continuous schedule. The center column of this chart reveals the second trap: medications that essentially unplug this biological timer, delaying the emptying process. Opiate painkillers and tricyclic antidepressants are the primary offenders responsible for halting this digestive timeline. When the clock stops, the food becomes trapped. It ferments inside the stomach cavity, generating excessive gas, severe bloating, and dangerous physical pressure against the walls of the organ. When these drugs paralyze the stomach's logistics, the organ stops moving, leaving food to sit and ferment in a stagnant environment. The final mechanism of sabotage bypasses mechanical failures entirely and engages in aggressive chemical warfare directly against the stomach lining itself. The final column of this chart highlights the specific pharmacological category responsible for causing this immediate direct irritation upon contact. Common over-the-counter NSAIDs and antibiotics like tetracycline are the exact medications that act as internal arsonists. NSAIDs are non-steroidal anti-inflammatory drugs, a common class of pain relievers that includes ibuprofen and aspirin. When one of these pills physically lands on the tissue, it chemically strips away the thick, protective mucosal layer, leaving the fragile cells completely exposed to destruction. Unlike the systemic side effects that break the valves and stop the clocks, this is a localized physical burn directly inflicted on the organ's walls. Now consider the compounded threat when a patient experiences broken valves, halted logistics, and direct burns all at the same time due to polypharmacy. Polypharmacy is the concurrent use of multiple different medications by a single patient. Ignoring these 3 overlapping traps ultimately leads to the severe structural collapse of the stomach lining, resulting in deep, bleeding internal ulcers. The resulting pain is an active alarm bell indicating ongoing structural damage to your organs. Mitigating this damage requires an active strategy. It means precisely timing your doses, utilizing protective biological buffers, and understanding the matrix of how these drugs interact. True health autonomy involves mastering the exact logistics of how medications interact with your biological fortress, allowing you to heal the body without compromising the integrity of its defenses.